Last week, we have talked about a wonder cure supplement that has the capacity to target the root cause of osteoarthritis. And since some of you have requested about rheumatoid arthritis, in this video, I will be answering commonly asked questions in line with RA. And stay with me until the end for you to know if it can be cured and what are other possible options. Greetings again to everyone. This is again Doc Cherry, Doctor of Physical Therapy. If you're new here in my channel, I would really like to encourage and welcome you to please click the subscribe and the bell button below for you to be a part of our growing community where you will receive weekly health videos on a weekend that will surely benefit our beloved seniors, you, and the people you love. Rheumatoid arthritis is the most commonly diagnosed systemic and inflammatory arthritis. It can cause inflammation and pain in not only one joint but multiple joints in your body, and it can affect other organs as well, such as your eyes, your skin, your lungs, and the heart. Unlike the wear and tear and the degeneration in osteoarthritis, which is linked with aging, rheumatoid arthritis is actually an autoimmune condition. This means that your immune system is attacking different tissues in your body, including your joints. With regards to your joints, in osteoarthritis, our main problem is the cartilage. However, in rheumatoid arthritis, what it affects is the synovium. The synovium is a thin lining in your joint that acts as a main way to provide nutrition for your joint. However, once inflammation due to rheumatoid arthritis creeps in, and if it is left untreated, these can cause irreversible damage to the cartilage and the bone, giving you joint deformity as what you can see in the X-ray result here. Women are more at risk of developing rheumatoid arthritis as compared to men. Smokers are also at risk, as well as those persons who have a family history of rheumatoid arthritis. In rheumatoid arthritis, you will notice redness, swelling, and heat on the affected joint. You will also notice that you will have morning stiffness that will last longer than 1 hour and that does not usually improve with activity, unlike as that of osteoarthritis. With rheumatoid arthritis, you will also have bilateral involvement of symptoms, meaning you will have the symptoms on both sides of your body. The most commonly affected joints with rheumatoid arthritis are usually your metacarpophalangeal joints here, or your MCP, and you have also your PIP involvement here. Other joints that are affected would include your elbow, your knee, and your hip, with the hip uncommonly affected with rheumatoid arthritis. In 25% of cases, you may also experience rheumatoid nodules. Rheumatoid nodules are these firm lumps of skin under the joint that is affected, and usually it can be seen in the elbow or in the extensor surfaces of your forearm. In other patients, they can notice joint pain first before the joint swelling. Other symptoms that are associated with rheumatoid arthritis would be fatigue. You easily feel tired. There is weight loss, and you will also have mild fever. These symptoms cannot be seen in osteoarthritis. Although I had mentioned a while ago that there is usually bilateral involvement of symptoms, or the symptoms are present in both sides of your body if you have rheumatoid arthritis, this is not included in the new criteria for diagnosing RA because in some cases it will initially start off with asymmetrical or involvement only on one side of the body. If you think you have experienced the symptoms that I have talked to you about a while ago, the best doctor that you can visit to have yourself checked would be a rheumatologist. A rheumatologist will be a doctor that specializes in different types of arthritis. The diagnosis of rheumatoid arthritis would be based on 3 factors: your symptoms, your past medical history, and the result of your laboratory and your x-ray. Presence of rheumatoid factor in your blood test will be one indicating factor for rheumatoid arthritis because this happens in 50 to 80% of patients with rheumatoid arthritis. However, it is not all encompassing because this may also be seen in patients who have hepatitis C. An increase in C-reactive protein and erythrocyte sedimentation rate would also be noticed if you have rheumatoid arthritis. And usually these are monitored and checked to see if you have responded well to treatment once your treatment or your management begins. If you find this video helpful so far, I would really appreciate it if you can take only 1 second of your time to please click the like button below so that I will know that you are learning something from my video. Patients with rheumatoid arthritis may experience what we call as deconditioning syndrome, wherein patients may experience decreased muscle strength, decreased flexibility, and decreased pulmonary fitness as compared to their peers who are not diagnosed with rheumatoid arthritis or RA. Other patients may also experience mild pins and needle sensation caused by nerve compression such as carpal tunnel syndrome, and in some cases there may be inflammation in the lungs and heart if not properly treated. To be honest, rheumatoid arthritis is more challenging to treat than osteoarthritis because it is systemic in nature. However, you have options. Your doctor can give you methotrexate, which is the first line of defense for patients with rheumatoid arthritis. They can also give you pain relievers and corticosteroids. The goal of this management is to stop the inflammation and prevent joint and organ damage. Plus, these medications can also help put your symptoms into a remission. There will be periods where you don't feel or you have lesser symptoms. Although as for the moment there is no cure for rheumatoid arthritis, early treatment and these medicines can help you prevent joint damage and it can help lessen the impact of the condition. Together with your medications, one goal is to increase overall well-being. On days where you feel better or you feel less symptoms, please be sure to do aerobic exercises. You can do simple walking, you can do stair climbing, or you can have a treadmill if you have one at home. This will increase your cardiopulmonary fitness and can help you with heart and lung health. You can also do progressive strengthening exercises if you notice that your muscles have become weak, and you can also use cold compress for 10 to 15 minutes on your painful and inflamed joints because this will aid with the pain and this will lessen the inflammation. Never use hot compress in an already inflamed and painful joint because it will further worsen your symptom. You can also opt to look for physical rehabilitation hospitals and physiotherapy clinics near your place for a personalized evaluation, and they will be able to help you out. When conservative management fails, joint replacements would still be another option, and your whole rehab team will be there for you every single step of the way. Although there is no cure for rheumatoid arthritis, there are different treatment options, and there is indeed hope for patients diagnosed with rheumatoid arthritis. Should you have any questions regarding rheumatoid arthritis or anything about this video, please comment down below because I would really get back on you. Please share this video to your friends and family members who are also complaining of painful and inflamed joints, because now more than ever, health is indeed our wealth. Thank you very much for watching. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you.